I think the biggest change is this shift in what we would define as the venue of care enabled by technology. And that's the move from geography and real estate owned by the healthcare providers to the geography and real estate and where the patient lives. And it's that shift where the four walls of the hospital or the doctor's office have effectively dissolved and we're bringing care into the home setting. Second to that is the ability to sort of understand and say, how do we really begin to understand who you are as a patient? And that goes way beyond your genetic code, that gets into the zip code, that gets down to concepts of the census tract, that gets down to individual behaviors and individual risks. So the second most powerful thing is this capability to know who you are using analytics by marrying together what we know about you clinically, what we know about you socially, and socio-demographically, and then third, actually understanding patterns of behavior in terms of risk profile. How do you behave compared to others that are similar, that have similar clinical conditions that might also have similar socio-demographic factors? So choosing what's best for patients from a technology perspective really starts with actually having to experiment with lots of different things. There's a tremendous amount of technology that's entering the marketplace, and a lot of it focuses on specific diseases or conditions, or particular populations of people, or a particular sort of technology advantage that it may bring. So part of what we have to do as an organization is really test and experiment with things that we first screen that we think have promise in terms of the approach. We also look at how do they sort of fit into what we call sort of clinical team workflow. So there's lots of solutions that enter the marketplace, but technologists that develop that have a great idea perhaps, but they have very little experience in healthcare. And a lot of them make this mistake of this sort of this core assumption, well, the doctor or the nurse will just do that. And that is a fundamental flaw in thinking. You have to really understand, how does the work, where does it actually fall? How does it fall inside a workflow that is natural for driving the progression and the course of care for a patient in a way that's natural for a way a care team will think, behave, and act. And if you fall outside that, you're really destined for failure. So we really look for tools that live within that sort of ethos to make sure it's within the workflows of a clinician. Second piece to that is that there's the work action, and then there's the insight derived. And how do you deliver and serve up that insight at the right place so that action can be taken on it, so that an outcome can be delivered to the patient in such a way. So critically important that we understand inside workflow versus outside workflow. Where it's going is this concept of the venue of care moves, the venue of care shifts, and the way we organize care is actually matching you. So we will actually have care plans that are as unique as an individual's personality is. So instead of basically building and saying one size fits all in terms of how we deliver care, we will understand what's important to you, what triggers you have, what risks you have, what strengths you have, what challenges you have, and we will actually organize care around you. And so what I think is really incredible is that the delivery of medical care, health and wellness, will actually be a combination of medicalized resources and non-medicalized resources. And that means we'll do things like if we recognize that you have a transportation risk and can't get to a place where we need to conduct a diagnostic test, in the future, not too far, we will actually organize the transportation for you. And the next generation after that will actually be we'll actually bring the lab test to you. And that could be in the form factor of a portable lab that arrives and they come in and they do it at your front door. It could be in the form factor of a drone arrives 18 minutes after you've gotten off of a virtual video visit with your clinician. It's got a lab collection kit of some sort. It's there, you drop it in and it's droned back, and in 18 minutes it's back inside the health system. 20 minutes later it's in the lab, and 20 minutes later they may have a diagnostic result and a clinician can come back to you. That ability to virtualize and digitalize the supply chain and layer in with new physical assets like drones and bringing care to you will be incredibly transformative. But it also becomes a necessary foundation because the cost of caring for populations today in an individual, we already know that the cost of constructing an in-person doctor's visit by building the real estate and all the infrastructure that costs is already too expensive. So what it really means is us building what I define as next generation operations. It's building healthcare through a digital supply chain and layering in the physical components where the physical components are required, but doing everything virtually and everything digital that's possible. But it also means building care that's stratified, that we may have patients that are in a particular sort of demography that are not going to be 100% virtual. And that means us accommodating for those patients as well. But what it does mean is that the physical space where we still have people come in and we maybe have to support the transportation to get them in for their visits, or we do a home health visit or some sort, we organize the care around them, and that each basically process and the resource at our end and at the patient's end will have this new optimization. So we'll reach this sort of balance where we're optimizing resources on both ends. We're not wasting resource time and we're not wasting patient time, that the model will work for everybody. Typically, if that's the case, I'm off the grid when we're out doing hiking or someplace where there isn't technology coverage. It's often a challenge for me to unplug, but I've gotten better. So getting to places that force me off grid is a great way to unplug from the technology. Even though when I'm out there hiking in those places, I'm still wearing my Apple Watch and it's tracking my fitness and tracking my exercise routine and calculating how far we've hiked and calculating vertical elevation. So I may be unplugged, but I'm still connected.